Hi, I'm Dr. Dorothy Polahar. I work at the Inova Integrative and Functional Medicine Center. I provide standard family practice. I see adults and children, so that's physicals, pap smears, prescription medication, but I also provide integrative and functional medicine. I do osteopathic manipulation, acupuncture, and herbal and supplemental medicine is indicated. So we also see patients as consults outside of primary care who are looking more at the integrative and functional medicine aspect of health. So patients come with a lot of different complaints and problems, and oftentimes they've seen a lot of different specialists, they've seen a lot of different doctors. They're frustrated, they're disheartened, nobody seems to be able to figure out what's going on with them. And my first job really is to give them hope. We're going to take the time today. We're going to learn their story. We're going to get it all out there. What are all their symptoms? When is the last time they felt truly well? On your first visit, my biggest question is, you could go anywhere, so I'm trying to figure out, why did you come here? What is it you're looking for from this practice? Because I do want to meet you where you are. Sometimes patients will say, well, I have all these problems, but I really think acupuncture is going to help. Maybe it wasn't my first choice to do for you, but if you feel that's going to be helpful, then that's where we're going to start. And maybe you have a laundry list of symptoms, but you really want to deal with this one. Okay, well, I'm going to work with that one first. We're going to keep all of these on the back burner because I think they might be part of the problem. And if things aren't going as well as we hope, then we're going to start kind of looking into those other symptoms. So I get asked a lot, what is a DO? Is that a medical doctor? Is it not? A DO is a doctor of osteopathy. So in the United States, DOs and MDs, they're really trained the same. DOs can take the same tests, do the same board exams, be any specialty, surgery, family practice, gynecology, etc. The only real difference in the training is that DOs are taught about 100 extra hours of anatomy, and they're also taught this osteopathic manipulation. Chronic back pain is such a huge problem in this country, and so it's nice to be able to see somebody who's had back pain for years and be like, well, maybe if we work on some of these things, and maybe if you start just this minimalist routine of maybe these 2 or 3 stretches, if you could just do that every day, and see them go from having pain every day to, well, occasionally I get a little tight, but I know that's because I've done this or that, and I kind of work on things. So osteopathic manipulation is a manual, hands-on form of medicine. So the techniques range from very light touch like that with cranial sacral to a little bit more active techniques, muscle energy, where patients are kind of pushing against me, and we're moving things through a range of motion. So my goal is to release the muscles, the fascia, move the bones, and kind of shift things in a gentle manner to move things back into the normal position. And I would say the success with them is getting to that point where you don't have to see each other all the time. Things are doing a lot better, and that once a year you check in and you look at all those symptoms and you say, what's come back? What is it that's going on with these symptoms? And how can we deal with that? Because to me, that's dealing with the clouds before the storm. If we can clear up the skies, then maybe that storm won't come. I'm Dr. Dorothy Polahar, and I'd like to partner with you and your family on your path to health and healing.